Chapter 8 is on antifungal and antiviral agents. So if you have a fungal infection, think of thrush. When you have, and I have a picture of that, when you have like a white patch inside your mouth, for example, that's thrush, and that's a fungal infection. A viral infection is if you have a cold sore, if you have if you know someone who has HIV, hepatitis, those are all viral. One common viral infection that we now know of is COVID-19. That's also a viral infection. So we're going to be looking at agents or drugs that help with fungal infections and that help with viral infections. So if you're infected with fungi or with a virus, antibiotics will not help because antibiotics are only good for bacteria and other organisms as well. Protozoa is basically, again, a microorganism that is found in wet or moist environments. Okay? But usually antibiotics are for bacteria. Viruses and fungi, we cannot use antibiotics on them because it won't work. So this is an example of thrush, also known as candidiasis, which you'll learn about in oral path. And basically it's when they have your clients have a white patch inside their mouth, and that usually is a fungal infection. So the most common course of treatment is using a medication called NYSTATIN. And NYSTATIN will help with reducing or eliminating the thrush in their mouth. We also have IMIDAZOLES, and there's many different types of medications that fall under this category. When you think of imidazole, think of the word azole as a hole. Think of a hole. And I'll tell you why later on, because this might be a trick in learning how to memorize these terms or these types of drugs. If you watch this video over here, it'll give you more hints as to what these really mean. So for now, just know that there are many fungal drugs or antifungal drugs that help prevent any thrush. They could be NYSTATIN or they could be one of these medications here, which fall under the imidazoles category. So how do the drugs work? What is the mechanism of action? How does it work? So this is a cell, a fungal cell, I should say. And when you zoom into the cell membrane, so cell membrane is that outer layer of the cell. When you zoom into the cell membrane, here we can see the phospholipid bilayer, and you may remember some of this from anatomy class, right? So we have the head and then we have the tail. In the phospholipid bilayer, you can see this yellow things that are in there, and those yellow things are called sterols. So they're called sterols, and in fungal cell is actually called ergosterol, okay, which is a sterol. And sterol are important in the fungal cell because what they do is they protect or they keep the cell membrane really strong. So they want, if you want a fungal cell to be strong, we're looking for sterols inside them because that makes the cell membrane really strong. And so the way NYSTATIN works is it takes away, or actually it actually binds to the sterols, and when it binds to the sterol, it tries to make the cell membrane weak, and when the cell membrane gets weak, the fungal cell dies. And so it could die completely, which is fungicidal, or it could be fungistatic, which basically means it slows down the function of the fungal cell. So it kind of slows down the cell, which means that you may not get that much of thrush inside your mouth. So NYSTATIN can come as a liquid, okay, so an oral suspension, or it could come it comes as a lozenge, and a lozenge is kind of like a candy, basically, that you suck on. And what happens with these candies are it stays in your mouth for about 15 to 30 minutes. So you're really sucking on it. Don't bite it, obviously, and swallow it. You want to suck on it because when you suck on it, it's spreading all over the mouth and hoping it's, doing what it has to do to kill all the fungal cells. The downside with this type of lozenge is that it is cariogenic, and that means that you can get lots of cavities when you take this. And the reason why is because there's lots of sugar in there. Okay, so there's lots of sugar in this medication, so that when you're swishing it around for 15 to 30 minutes, it could affect the teeth. It could cause cavities. People with dentures can use NYSTATIN. So if you know someone who doesn't take out their dentures, who doesn't remove their dentures at nighttime, they could get a fungal infection, and using these type of medication will help with their fungal infection. So imidazoles, which is the next category of antifungal drugs, there's 3 different ones. So the first one we're going to look at is called CLOTRIMAZOLE. And the way this works is, actually here's a tip. Remember, azole kind of means, you can think of it as a hole. So think of a cloth, from clot, that's stuck in a hole. And that's how you can remember it. It's CLOTRIMAZOLE. And azole is one of the imidazoles. So think of cloth in a hole, and that's how you can remember CLOTRIMAZOLE. And again, this is also helpful for fungal infections. So when you have thrush, for example, and it comes in a cream or even as a lozenge, which is a candy that you suck on for 15 to 30 minutes. And remember, sugar content is high. Then we have another one. This is called KETOCONAZOLE. And KETOCONAZOLE is, again, a different type of antifungal agent, a different type of antifungal drug. And what it does is it helps with any thrush or any oropharyngeal candidiasis. And I'm going to go over what this word means, but basically oro comes from the word mouth. So if you have a thrush in your oral cavity in your mouth, or in your pharynx, which is like the back of your throat. So if you have any thrush in the back of your throat or inside your mouth, candidiasis is like the white patchy area, then this medication can help. Of course, there are always side effects with all medications, and most of the side effects usually involve nausea, vomiting, and it can also cause hepatotoxicity, my mouth. And what that basically means is when your liver starts to go crazy on you. So when you have liver damage. Okay, the next antifungal drug we'll look at is called FLUCONAZOLE. And so think of someone having a flu inside a hole, FLUCONAZOLE. And again, the way this works is it prevents the synthesis of this yellow thing that we're looking at in the phospholipid bilayer. And so when we have this sterol, so remember, when the sterol is inside the cell membrane, it keeps the cell strong. But what this medication does is it prevents the sterol from getting into the cell membrane. And when we have no sterols in the cell membrane, we may not have a fungal infection because all the fungal stuff will go away. So what is this medication good for? This medication is good for any oropharyngeal or esophageal candidiasis. So any thrush, any white patches that is in the oral cavity. So oro means somewhere in the mouth. Pharyngeal comes from the word pharynx, which is the back of your throat. And esophageal is kind of down here. So if you have thrush anywhere over here, then this is a good drug to take. What's more important is it's actually really, really good in people who are immunocompromised. And what immunocompromised means are people who have other health conditions. So they could be diabetic, they could be cancer, they could have cancer, they could have heart problems. So they have other stuff that's going on in their body. That's what immunocompromised means. So we looked at fungal infection. Now what we're going to do is we're going to look at viral infections. And with the viral infections, one of the common ones or the ones that we are familiar with is the herpes simplex viral infection. And this is basically when they have cold sore. So when you have a cold sore, I hope you know that we cannot see clients who have a cold sore. And the reason for that is because it's very, very contagious. Let's say I'm working on this person's mouth and this cold sore pops. And if this cold sore pops and the pus lands somewhere else, that means that this client will have another cold sore somewhere else in their mouth. So it can spread, it's contagious. Another way to look at it is that if this pops and it lands on my face, or even though I'm covered in mask, maybe there's one area I wasn't covered and the pus landed on, somewhere in my face. Now I could get infected and I could have an infection somewhere in my face. So herpes simplex or cold sores, very infectious. AIDS is another type of viral infection that we'll look at, and AIDS is we are at risk for AIDS, and I'll tell you why. If our client has AIDS or HIV, so the way AIDS actually work, let me backtrack here. The way AIDS work is if you have HIV, so if someone has HIV rather, and it's not treated, the HIV can progress into AIDS. And when you have AIDS, that's really bad because the chance of you living a long life is very slim if you have AIDS. And AIDS basically means that you have an immunodeficiency syndrome, which means that your immune system is not working, which means that you can get sick more often because your immune system is not working, it's not helping you recover from your sickness. How do you get AIDS? How do you get HIV? Usually it's exchange of bodily fluids. So it could be exchange of blood. So think of drug abusers who inject themselves with drug and then the needle is shared with someone else. So now their blood goes on to someone else's blood because they're sharing needles. And when that blood goes into someone else's bloodstream, it could be, that person could have it passed along HIV that way. So through blood. It could also be through bodily fluids, so like people who have sex. It could be sex workers, it could be men who have sex with men, transgender people. Anytime there's exchange of bodily fluids, they are at risk for HIV. Now, we use universal precautions, which means that when we're in clinic, we assume that everyone has HIV or AIDS, and that's why we make sure we wear our gloves, we make sure we have masks on, and we sterilize, we do all that so that we can protect ourselves from getting infected with HIV or AIDS. So basically, when we're in clinic, we're always assuming that our client has HIV or AIDS. That's why we're always using universal precautions. We're always treating everyone the same by wearing masks, gloves, and all that. Now, one medication for herpes simplex, so this is the cold sore. I don't know why it shouldn't say antifungal here. I'm sorry, it shouldn't say that because it's antiviral. Let me change that to antiviral. Is aciclovir. And aciclovir is a cream that you would put on the cold sore. And what it does is it basically tries to heal or get rid of the cold sore. Of course, there's always going to be side effects. So this is the side effects: burning, stinging, or some slight pain. Now, this type of medication could be used for herpes simplex 1. It could also be used for herpes simplex 2. The main difference between the two is herpes simplex 1 is like a cold sore in the mouth. Herpes simplex virus number 2 is in the genital area. Abreva, this is something you may be familiar with. So this is another type of drug. Docosanol 10%. And what this does is you don't need a prescription for this one. So this is the one drug you don't need a prescription. And again, you put it on the cold sore as a topical. So you just apply it on the cold sore, and it's hoped to shorten the healing time by half a day. So instead of it taking one whole day for it to heal, maybe it'll take half a day for it to heal. And then we have other types of PENCICLOVIR, which is another type of, again, it says antifungal, I should say antiviral. My apologies. So this is another type of antiviral drug, and what it does is it again helps with cold sores. Now, sometimes we could have clients or patients who have cold sores or who have genital herpes that is happening again and again and again. Or we could have people who have chicken pox or shingles. So this is from the Varicella zoster type of viral infections. And when that happens, when it's a very severe case, then you want to use a stronger medication. And these are the stronger medications to take. Let's go back to AIDS. So if someone has AIDS, again, it starts off with HIV and then it progresses to AIDS. There are many different types of medications they need to take. So there are actually, for the sake of this class, just know that there's 3 types of drugs that needs to be taken. It's 1 drug from this side, or this category, 1 drug from this category, and 1 drug from this category. And basically the way it works is they're inhibitors, which means they stop the virus from growing, they stop the virus from spreading in the body. Because if the virus spreads in the body, you'll get more and more sick. So the function of these drugs is to stop the virus from progressing. And I had a video that I forgot to tell you earlier, but I do encourage you guys to pause this recording and watch this video, because this is a good summary of how HIV and AIDS work in your body. Okay, the last one is hepatitis. And so if we have hepatitis, our liver will get inflamed, and liver is really important. We need our liver to process nutrients, we need our liver to filter the blood, we need our liver to fight any infections. So liver is a vital organ, and if we have hepatitis, it can affect our liver, which is not a good thing. Hepatitis B, this is a vaccination. A vaccination that we all took when we entered into dental hygiene program, because we are at risk for hepatitis B. Blood from our clients could enter our bloodstream, and think about how. Think about if I was debriding a client who has hepatitis, and as I pick up my instrument, so let's say as I pick up my sickle, which is already coated in blood, now when I'm picking it up, I accidentally poke myself. And if I poke myself, that blood that was already infected with hepatitis now enters my bloodstream. And when it enters my bloodstream, now there's a chance that I could now have hepatitis, the hepatitis from that sickle instrument, from the, in the blood. So again, in the sickle instrument, there's blood. In that blood is hepatitis. When it enters my bloodstream, I got poked, let's say I got poked by the sickle, and now the blood from the sickle entered into my bloodstream, I have a chance of getting hepatitis. I also have a chance of getting HIV if the client has HIV or AIDS. So I'll talk about what happens if that were to happen to us. But before I talk about that, let's talk about what our dental hygiene considerations are. We want to educate our clients. So if they have thrush, we want to tell them that there are medications out there that can treat their thrush. If they're not removing their dentures out at night, we want to tell them, make sure you remove your dentures, because if you don't, it can cause pain. It can also cause thrush. We want to tell them that if they are to use any antifungal drugs, like NYSTATIN, for example, and if it's a lozenge where they're just swishing it in their mouth, make sure that they brush after they use it, make sure that they rinse with water, because if they don't, there is a higher chance that they could get cavities, okay? Because remember, those lozenges have a lot of sugar. Now, what happens if you get poked? If you get poked with an instrument, with a bloody instrument that's not sterilized, of course, there is a chance that now you could get infected with HIV or hepatitis or any other disease. If that happens, we tell you to stop treatment and go to the nearest hospital, and go to the emergency. And in the emergency room, you would tell the doctor that you got exposed, with an instrument. And the clients don't always tell you whether they have HIV or hepatitis. So you would talk to the doctor, and the doctor may prescribe a post-exposure prophylaxis, which is an antibiotic that you would take. And it's a very strong antibiotic, and there are very strong side effects. So, I've had students who used to throw up in clinic because they, when they came back the next day, or they would have, stomach pain, because it's a very strong antibiotic. What's important is that you go to the hospital within 72 hours, because if you wait longer than 72 hours, you could get exposed and there's no chance of you recovering. So you want to go as soon as possible, right? The sooner the better, but at least before the 72-hour period. Very, very important. In the past, when this has happened, we usually ask the clients, to sign a form where they say that yes, they're willing to go for blood work. And when they go for blood work, if it comes out clear, if it comes out as if they have no HIV or hepatitis, and if they're willing to send you the blood work, then you're fine. Then maybe you don't need to take those strong antibiotics to prevent you from getting infected with HIV or Hep B. So sometimes clients are willing to go and do the blood work for you, like almost right away, so that you know that they are not infected, and so that you have that peace of mind, and you don't have to take this antibiotic, which is really, really strong. Okay, that's it. Thank you for listening.